Welcome back, class. This is Mrs. Ohms. We are now continuing on Unit 11, Circulatory System, which is Chapter 19 in your book. Circulatory system, or cardiovascular system, both the same thing. Circulate because it circulates blood. Cardiovascular because it involves the heart and blood vessels. So it's the same thing. Vascular means vessels. So within that system, circulatory or cardiovascular, is the heart, the blood vessels, and the blood. The heart is a muscle. It has 3 layers. If you know medical terminology at all, peri means around. So the pericardium is the outer layer that surrounds the outside of the heart. Myo means muscle, so it's the actual muscle of the heart. And endocardium is the inside layer of the heart. The main job of the heart is to pump blood. There are 4 chambers of the heart. We have 2 atria. We have atria and we have ventricles. Atria is the plural form. Atrium is a singular. So you have a right atrium and a left atrium, and you have a right ventricle and a left ventricle. Atrium on the top, ventricles on the bottom. Function of the heart, it pumps blood throughout the blood vessels to every cell in the human body. There are 2 phases of the heart. We have systole. Both have to do with the ventricles, which are the bottom. The ventricles are considered the contracting, where the atrials are more receiving. So, or the pumping part of the heart. So the lower chambers, the ventricles, they will contract, and that's systole. And at that point, they contract and push blood up. And then diastole is when they relax, and then they fill with blood, or the relaxation phase. There's a video there I can send to you to watch that later, but it just shows that process of systole and diastole. Flow of blood through the heart. So this is your heart. You can see blood enters the heart in the right atrium. So everything on the right side is blood that has not been through the lungs yet. So it's coming in from the body, going into the heart to be oxygenated. So it comes in through the right atria, then down to the ventricle. Ventricle pumps it up to the lungs. In the lungs, it becomes oxygenated, and then it re-enters the heart on the left side as oxygenated. Re-enters through the left atrium. And it's the left ventricle that pumps blood out to the rest of your body. Oxygenated blood, that is. Blood vessels, we have arteries. Arteries carry oxygenated blood away from the heart. Your largest aorta, or largest artery, is your aorta. I always try to remember arteries away. They carry it away from the heart. Veins carry blood to the heart, so it's coming to the heart to become oxygenated. So it carries deoxygenated blood back to the heart and through the vena cava, which is the largest vein. And capillaries are where arteries and veins meet, and that's where the exchange happens between oxygen and carbon dioxide. Blood transports oxygen, removes carbon dioxide, controls our pH, which is our acid and alkalinity of our blood, of our body, I guess, and clots and fights pathogens and poisons. So blood itself, blood is made up of solids and liquids, cells and plasma. Blood cells are 45%, so down on the bottom where the red and the little skinny line are, those are your blood cells. Those are your white blood cells and your red blood cells. 44% is red blood cells, and then there's a thin layer there. 1% is your white blood cells. And so that's the solid, what's considered the solid part of your blood, and the liquid is the plasma, which is the top there. So I don't know if you've ever seen anybody spin down blood that's in a tube. It'll separate where the plasma goes on top because that's the liquid, and then the blood cells go to the bottom and clot. Red blood cells carry hemoglobin, which carries oxygen through blood vessels. They are produced by the bone marrow. Iron found in bone marrow and RBCs give blood its red color. RBCs function for a short time. They only live like 120 days, and then are filtered out by the liver and the spleen. So the medical term for a red blood cell is an erythrocyte. White blood cells, or leukocytes, protect the body from bacteria and viruses. When bacteria and viruses invade, a WBC rush to the area and multiply rapidly. WBCs are produced by the bone marrow, spleen, and the thymus. And these are the different kinds of white blood cells. There's not just one. If you have, and a lot of times they can tell by looking at the majority of which type of white blood cell you have, what kind of infection you have. If you have a lot of lymphs and monocytes, they tend to think more viral. And if you have a lot more neutrophils, and they'll think bacteria. So there's a lot of little, by looking at your white blood cells, they can kind of tell what's making you sick. Eosinophils, if that's elevated, is usually an allergic reaction. So it's interesting to get in there and look at the microscope at the different kinds of white blood cells. Platelets, they cause the blood to clot. They are produced in the bone marrow. So I guess this is a picture here of somebody who does not have enough platelets, so they're bruising very easily. Oh, that's just a duplicate slide, I believe. Okay. Changes in the circulatory system due to aging. Your heart pumps less efficiently. Blood vessels narrow. Blood vessels are less elastic, and blood flow decreases. Disorders of the circulatory system. Hypertension, which is the medical term for high blood pressure, is a consistent blood pressure over 140/90 or higher. The major cause of hypertension or high blood pressure would be hardening and narrowing of blood vessels. Signs and symptoms are not always obvious. That's why sometimes it is considered the silent killer. At risk for heart attack or stroke if uncontrolled, and kidney disease and blindness. That's why we always want to baseline vitals. You want to keep your blood pressure where it should be, because it can cause organ damage if not get in line. So the treatment is usually medication, exercise. Sometimes people are just salt sensitive, so they may start with that first, with a low sodium diet, and see if that helps. Myocardial infarction. There's somebody giving CPR. That is the medical term for a heart attack. A myo meaning muscle, heart, cardio heart infarction, which means no blood flow to the heart arteries. So just need to know that heart attack and myocardial infarction are the same thing. But not the same thing as cardiac arrest. Cardiac arrest is when your heart just stops. Your heart can stop for other reasons than a heart attack. So all are part of the blood supply. When you have a heart attack, all are part of the blood supply to an area of the heart muscle is blocked. So it's those coronary arteries that are on outside of the heart. One of those will get blocked, and then the heart can't receive oxygen, and then that part of the heart muscle dies. Another disorder of the circulatory system is coronary artery disease. Causes, there's a buildup of plaque in the arteries of the heart, causes damage to the coronary arteries. Like I mentioned before, your coronary arteries are the arteries that lay on the outside of the heart. Myocardial ischemia is when heart muscle does not get enough blood and therefore lacks oxygen, which can cause chest pain. Chest pain, the medical term for chest pain is angina pectoris, chest pain, pressure, or discomfort due to coronary artery disease. Congestive heart failure, or CHF, is when your heart fails to pump effectively due to damage of the heart muscle. It could be left-sided or right-sided failure. The signs would include edema, difficulty breathing when lying down, which the medical term for that is orthopnea. So somebody who has to sit up to breathe has orthopnea, and weight gain is from the fluid retention. Treatment is diet, medications, and when we talked about nutrition, we talked about people being on a fluid restriction. Somebody on congestive heart failure would be somebody who could potentially be on a fluid restriction. Peripheral vascular disease, PVD, is a condition in which blood supply to the legs, feet, arms, or hands is decreased due to poor circulation. Deep vein thrombosis. A thrombus is a blood clot. With deep vein thrombosis, a blood clot forms in a large vein that's often in the leg. An embolism is a blood clot that has broken loose and is moving through the circulatory system. So deep vein thrombosis is just kind of embedded in the leg, and you know you got a blood clot in your leg. If it breaks through and lodges, then it turns into an embolism. And in that case, it can be fatal because if it lodges in the heart, it causes a heart attack or an MI. If it lodges in the lungs, it causes a pulmonary embolism. And if it lodges in the brain, it could cause a CVA or a stroke. It can be fatal. That is why we wear anti-embolic compression stockings, or TED hose. They are used to increase blood circulation and prevent thrombus in the legs. After surgery, a lot of doctors will order TED hose or anti-embolic socks. They can be knee-high or thigh-high. Their measurements are taken to make sure you have the right size. They are best applied in the morning while the feet are still elevated and before the resident gets out of bed. So they are applied while they are in bed still. They have a seamed hole to allow assessment, so you can look at their toes and make sure that their nail beds aren't blue and there's good circulation. Like I said, they can be knee-high or thigh-high. Sequential compression device, or CSD, they utilize a plastic air-filled sleeve to improve circulation, reduce fluid buildup, and prevent blood clots. So often after surgery, somebody might come back with a SCD machine. And the machine inflates and deflates, causing alternating compression of the legs, similar to what your legs would do when you're walking, kind of making those muscles work. And that is it. That's a long one, 12 minutes, sorry.